Okay, welcome to everyone for attending. We now have over 30 attendees, so this is excellent. Welcome to everyone all around the world, your different time zones. As you will already know, this session is looking at a public health agenda for traditional, complementary and integrative healthcare. I'm Distinguished Professor John Adams from Australia, University of Technology, Sydney, and it's my pleasure to chair this session and also to introduce you all just very, very quickly to the program, to the speakers. I'm going to allow the speakers to introduce themselves when it's their time to actually talk and present. I think that's the best way to do it. And also just to make a few passing remarks at the beginning to set this session up. Just a bit of housekeeping for all of you attending. If you haven't already and you're not speaking, please could you mute your microphones. The system will only cope with 4 microphones at once, and it's probably good that we avoid having a crash. So if you're not talking at the moment, please do mute your microphone. Also, another bit of housekeeping very, very quickly is there is a chat facility on this system, and if you do have questions, please feel free to write some questions in the chat facility and we'll try and get to those at some opportune moment a bit later on in the piece. So just very quickly, I'm John Adams, as I mentioned. Our second speaker will be Daniel Galeja Perez, and then we have Ricardo Gelman, and then finally John Wardle will finish the set, and then we will hopefully have time for Q&A as well. So just a few things about myself. I'm a distinguished professor of public health. I'm a deputy head of school research at the School of Public Health at University of Technology, Sydney. I also direct the only critical public health research centre in the world on traditional, complementary and integrative medicine, ARCM. And recently I was very privileged to receive a Fulbright Senior Scholarship on Integrative Medicine and Vulnerable Populations. So enough about me. Let's talk a little bit about the context and the build up to this session and why we thought this was such an important session to run and to expose this agenda to the public health community in Rome and at this World Congress. So there has been quite a lot of development work that the 4 of us now in this session and presenting today with our colleagues and partners have been developing around this agenda. But I'd just like to say a few words before I give space for the other presenters to tell you in detail some of their thoughts and arguments about this topic. So the kind of associations, they're already up there on the presentation. We have public health, national public health associations all around the world, in Australia, Brazil, in America, North America, also Indonesia, South Africa. All these associations have special interest groups or have designated sessions or groups that look at traditional, complementary and integrative healthcare. So there has been some fairly productive and very successful groundwork around this particular subfield of public health. But what we wanted to really intimate to you today is the idea that perhaps there's quite a lot more to be done. And I do believe that there is still a lot of room for the mainstreaming of thinking about this topic within critical public health as a discipline. Globally as well as on national scale. So just to kick us off, I'll say a few words about what do we mean by traditional, complementary and integrative healthcare. These are, I will explain the 3 different definitions in a second very, very quickly, but basically all these medicines, health systems, practices, behaviors and technologies that we're referring to today are all brought together by one overarching feature, which is the fact that they are politically, traditionally not associated with the dominant medical profession of the culture and the medical curriculum of that profession. And just to give you some very obvious examples here in Australia would be acupuncture, naturopathy, massage, herbal medicines. There's a whole range of both, there's over 250 practices that have often been defined with this categorization. Just a very quick introduction to the difference between traditional, complementary, and integrative healthcare. Traditional medicine is medicines that are indigenous to the culture in which they're used. Complementary healthcare or medicines are usually referred to exotic practices that have been imported to a culture. And integrative healthcare is, in a very quick definition, the combination and concurrent use in practice of both traditional, complementary, and integrative healthcare with conventional biomedical practices. The other thing I would just very quickly like to say is just make an overarching remark before Daniel gives his presentation, which is just that despite the fact that there has been some movement and an emergence of interest in this topic, it still is highly underdeveloped from a public health perspective. And what we're really proposing today in a broad brushstroke sense is that we need a very strong critical program of looking at traditional, complementary, and integrative healthcare within the discipline, within the global field of public health. And just to make a very obvious statement about this, what we're here talking about as well, just so we can be clear with people, is a multidisciplinary and a multi-method approach that is critical, scientific, and rigorous, but draws upon all the different areas and fields and disciplines that public health houses. So we're not just talking about randomized controlled trials and clinical evidence. We're not just talking about epidemiology. We're not just talking about health economic modeling. We're talking about a whole range of different disciplines and methodologies that can be used to look at this topic and conduct it subject it to scientific investigation. So I think on that note, I'd like to hand over to Daniel. I've taken my 9 or 10 minutes up. Daniel, I'll do a timing and I'll give you a quick nod and come in when you're about 10 minutes down, if that's okay with you. If you'd like to introduce yourself and your presentation. Thank you.
Thank you, John. Thank you for the nice setup. Good morning, afternoon, or evening, wherever you are in the world, and thank you for being with us today. My name is Daniel Diego Perez, as John mentioned. I'm here representing the Integrative, Complementary, and Traditional Health Practices section of the APHA, the American Public Health Association, and it's great to be here with you. So first, I would like to mention that behind us, we have the entire history of our shared humanity and the history of the medicines of the several civilizations that have preceded us. And often, as we will see and as we all know, often in healthcare systems around the world, mainly predominates one way of understanding life and one way of understanding medicine, which is most frequently the biomedical model. But most recently, there have been a series of global agreements that have shed light on the importance of taking into consideration this other array of health systems and healing systems and practices that are not mainstream, that are not within what is considered today conventional medicine or more specifically biomedicine. Since the Alma Ata Declaration, it was recognized that traditional health practitioners should be understood as part of primary healthcare team. and that there was a role for traditional health and the traditional knowledge and practices within what we understand as primary healthcare. That agreement was ratified in the Astana Declaration most recently in 2018 on the celebration of the 40th anniversary of the Alma Ata. And last year, at the UN high-level meeting on universal health coverage, was also uh, was also taking up the importance of the integration of this knowledge into primary healthcare. Yet, um, the, even so, the WHO has put together a series of uh, frameworks, including the traditional medicine strategy, that has encouraged member states to integrate these approaches into their healthcare systems. And there's a series of WHO of declaration of the World Health Assembly that has encouraged that trend. Last year was also published the global report on traditional and complementary medicine of the WHO, where we see that 88% of member states reported that there's use of these approaches within their healthcare systems. As you can see, most countries in the world, and no country deny its use within their territories. That 88% corresponds to the fact that some countries did not share information on time before the report, when the data was collected. And there's a growing trend on the number of countries that have developing legislation on traditional, complementary, and integrative health and medicine. As you could see, is an important number. Yet, when we are in a shared space like the World Congress of Public Health, we see that there is a disconnect between the public health agenda at a global scale and the fact that these systems are practiced all over the world and represent a very important percentage of the health services within healthcare systems. And in the World Congress of Public Health, where there's more than 3,000 abstracts and on presentations and posters, 150 workshops, and there's only one session dedicated to this topic, and it's this that we are on right now. And so we see that there's a disconnect, and we see that there's a need for bringing forward an agenda on this topic. In all healthcare systems, and there's always, in one way or another, the presence of traditional complementary health practices, and there's a growing trend on the integration of these services and practices. And yet it seems like in public health we are not asking ourselves enough questions about this. The COVID-19 pandemic has brought also the issue of has begged questions of why we are not considering these approaches within the response to this pandemic. It has been very interesting to see how, in many contexts, and particularly in Western countries, it has been even a taboo to ask whether there's anything beyond protecting oneself to the exposure of COVID-19. We know that infection, there's always an interaction between an infectious agent and a person who has an immune system and a response to that agent, and somehow that question of the interaction, that question of the immune system, has been put aside during this pandemic, and often the the response from the media when there's any consideration to traditional and complementary health practices is often very critical. As we see that there's countries that have taken a more bold approach into integrating or into considering these approaches in their national responses, as we have seen in India with the Ayush Ministry, or China with an interest in also using complementarily the traditional Chinese medicine approach, yet is often portrayed very critically without a balanced approach. Though the WHO office in regional office in Africa has also been very interested in trying to push a regional agenda in that continent for studying more, but in a more balanced way, the contributions of traditional medicines and herbal medicine for the response to the pandemic. If we want to move forward and make progress toward advancing on the objectives for sustainable development, we need to consider these approaches to health and medicine. We need to consider all the ways of understanding health and healing, and we need to take this all into consideration in order to include everyone, because culture is one, and the different ways of seeing health and disease is very important to try to bring everyone into the table. I just want to highlight that that there's groups and collectives that have been trying to find a middle path in this approach, such as the traditional complementary and integrative medicine network in the Americas, where have been developed evidence maps and international events, and providing information to try to shed light a little bit on the importance and the contributions of these approaches, which are all available in the virtual health library on TCIM that this network has put together. And finally, I would like to remark that the WHO has been calling for a more balanced approach and complementarity between the biomedical understanding and way of the way of understanding health and the way of understanding services, and also those that are developed by other healing systems, and we need to find a middle path to be able to move forward in this agenda. Thank you very much. And
thank you, Daniel. Thank you. Bang on time as well. That's fabulous. Thanks. Ricardo, if you'd like to present next, that would be wonderful. I'll give you a heads up when you've got a couple of minutes left.
Yes.
Thank you,
John. Thank you, John, for the wonderful introduction. And Daniel, I'd like to share our experience from Brazil. I'd like to share my presentation now. Yes. Can you see? I'm Ricardo Gelman, and I come here as a South American representative, a member of the Traditional Complementary Integrative Medicine Committee of the Brazilian Public Health Association, and also I'm chair of the Brazilian Academic Consortium for Integrative Health that joined the group of researchers in our country. I'd like to focus in our national policy, named Integrative and Complementary Practices in the public health system. That started in 2006, that we have 14 years of policy devoted to TCIM, that's our team. Just to have give you the vision about the size of Brazil and the implementation of public primary care, nowadays 75% of the population are covered, and 65% of population, that means more than 130 millions of people are covered for family health teams. That means 42,000 family health teams in 42,000 of basic health units. Our national policy of integrative and complementary practice have the main goals to incorporate and implement TCIM in national public health system, increase population access, contribute to increase health system efficiency, promote best practice, and act in prevention, promotion, assistance, rehabilitation using TCIM. Strengthen community participation to networks. Nowadays, the integrative practices are present in 70,000 establishments, or 15 are in the primary health care. That means 90% are in primary health care. Different from the experience from Europe or in states where are more in hospitals. We are more based in primary care. And 77% of the municipalities, that cities, are covered for at least one modality. The evaluation is that 5% of population benefits from the provision of this type of care in public health system. The offer of that approach achieve the main disease admitted in the system, in the public health system. According to the records, hypertension, diabetes, and that area of pain, osteoarticular problems that you see, breathing problems, reproductive health care, headache, and mental health disorders. The policy included, since 2006, three categories of or modalities, but three categories of approaches that you can divide in whole medical system. That means traditional Chinese, homeopathy, anthroposophic medicine, Ayurveda, naturopathy. The natural products that are organized from our agents to regulation. That means phytotherapy, thermal therapy, apitherapy, aromatherapy, ozonotherapy, gel therapy, and then a lot of non-pharmacological therapies that usually are mentioned as body-mind therapy, but we included a more broad category that include meditation, Reiki, touch therapy, music therapy, art therapy, dance, chiropractics, reflexology, Shantala, hypnotherapy, familiar constellation, bioenergetic, and chromotherapy. And I would like to emphasize the integrative community therapy that it's made in Brazil, that it's spread around 27 countries. It's a wonderful model of care in the health, in psychological problems and mental health disorders. Looking to the different biomas in Brazil, one area of very important to share is the research in the field of medicinal plants. And one example, the babaçu, that plant doing some new research showing advance in control of pain and the anti-inflammatory possibility. And this is, for other hand, not available in the market. Then you have a distance between the research and the access. As Daniel Diego mentioned, we are partner of and connected with that big network of TCIM American network that have the virtual health library that collected a lot of evidence in that field. And our Brazilian Academic Consortium and the Observa PIX have a lot of work done in cooperation. One of the examples is the symposium that are done only to the COVID that engage 12 countries. And the health, that virtual library organize the publication, and it's amazing to see that we have now more than 1 million and 0.5 publication connected with that theme. And also in our Brazilian consortium, we create the area to search and to translate to several languages. The evidence map on COVID was published recently from the work of that TCIM network. And I'd like just to share quickly several evidence maps that we did as from a question from the Minister of Health that asked for policy informed by evidence. Then just to have the names of and the numbers of reviews that we did 12 maps from acupuncture, meditation, medicinal plants in different areas from physiological and metabolic disorders, and for chronic disease and pain, but yoga, for phytotherapy for mental health, auriculotherapy, ozonotherapy, reflexology, and also to body-mind practice of traditional Chinese medicine, and from children's Chantala and oral ozonotherapy. And just to conclude, the new step now is to create more communication between the research and the policymakers through the Center of Knowledge Translation. We started some months ago that project to create materials to allow the policymakers in several levels to achieve the information. And our dream is in the future to create a multilateral network of collaborative centers in that field of traditional medicine. Is really a dream that we need to go forward to really allow the possibility to achieve in the public health system globally in a best way. Thank you very much.
Thank you, Ricardo. That's fabulous. And again, wonderfully kept to time. John, if you would like to present, that would be marvelous.
Sorry, my mute button froze, but I am here now.
Oh, good.
Thank you. Thanks, John. I'm another John, John Wardle. I'm a professor of public health at Southern Cross University and director of the National Center for Naturopathic Medicine, another center that's very, very committed and interested in developing a public health agenda for traditional complementary and integrative health, to use the WHO terminology. So I think I've been tasked with just giving a wrap up of some of the ideas to contextualize and move on into the next steps. And I think John started really eloquently just by highlighting, I think, the disconnect between the prevalence, the utilization, and the presence of traditional and complementary approaches to health, and the attention they actually get from the public health community. This is something that is essentially half the healthcare sector globally now. And what we're seeing with the research that is being done is that even with increasing conventional health service access, this doesn't actually reduce the use, it actually increases it. So people do actually work, actively choose to have complementary approaches, even with very, very good access to universal healthcare. So I think he also very eloquently, pointed out that this is a multidisciplinary and multi-method approach that's needed, because historically, this issue has been one that's been dominated by clinical researchers. Obviously, issues of efficacy and effectiveness are very important, but taking an ecological and holistic perspective of how these practices impact public health, what opportunities they provide, and what potential problems they may impact is an incredibly important question, deserving of further rigor. I think as Danielle moved on, talking about how health policy is moving forward, it is something that is growing, but probably not growing fast enough in terms of the attention that's actually been given. So he's given a few examples, and one of the ones he gave actually was the Africa region's work around COVID, and having worked with the WHO Africa office led by Ossie Casillo, this is a perfect example of the work they had to do to provide the guidelines to actually do research in traditional medicines for member states, because there was a very, very poor knowledge base of how researchers in those countries could actually actively look at potential solutions to COVID. So to actually ensure that rigor was connected, there actually had to be a rigorous public health gaze at the issue to develop those standards and guidelines initially. Ricardo gave a really great example of some of the practical aspects of implementation, and I think the thing that I really liked from that talk is when he talked about integration, the appropriate integration. The things that came up were about access improvement, improving access, accessibility, improvement and efficiency of the healthcare system, and I think that's something that public health probably does better than clinical researchers, because we are used to taking that sort of broader, holistic, ecological perspective, and these therapies don't exist in a vacuum. They're not used completely independently of any other services or completely independently of any other social or cultural norms. Health, like anything else, is political. There's a whole heap of political aspects that go around that, and public health is really, we think, the discipline that really is best to sort of engage with some of these areas. So as we move forward, what I am going to do, this isn't our first workshop. Actually, John and I, together with Amy Steele, way back in 2014, actually did an initial workshop at the World Congress of Public Health in Kolkata. We extended that in Melbourne, and now it's actually advanced to this stage here with the World Leadership Dialog. But in preparation for this, and obviously circumstances have changed a lot of things as we've moved forward. What we have done is, over the past 2 years, we have actually been conducting similar workshops to develop a public health agenda, to get input from attendees who are interested in this topic on what that public health agenda might look like, what topics are important from a public health perspective. And we've done that at public health conferences, national and international, as well as traditional complementary and integrative hospital conferences. So there were 3 events that we had hoped to have an in-person workshop at this year. One was a side event in Geneva for WHO, one was the Cleveland US North American Conference, and obviously this one here, but we will make do as well we can. So to give you an insight of what came up most importantly, if you look at the traditional medicine, traditional complementary and integrative health conferences, like, I guess by virtue of the audience that we actually had, it was very focused on, I guess, more practically, clinically relevant questions, largely around integration, collaboration, the evidence base and standards of the practices and products, either through education, regulation, or some form of other regulatory mechanism. Obviously, other factors were there, but they were definitely the ones that emerged. If you looked at the public health conferences, I think this really is testament to the multidisciplinary and multi-method approach and view that public health communities tend to have as well. There were a lot of really interesting things, nothing incredibly dominant, but everything from obviously issues of integration and evidence and efficacy, but also the idea of meeting unmet needs. The opioid epidemic was obviously one that was important, but also things like sustainability. So ensuring that sustainable harvesting of natural products is actually not denigrating the environment, or including making sure that any integration is done in a respectful way. So if we look at some of the, I guess, emergent themes, and these are, I should put out, very rough. So standard sustainability and safety. So regulations and standards of practice and evidence was quite held up to be quite important by the participants. Regulation of claims and incorporation of other forms of knowledge. This was actually something that came up, and we'll talk a little bit more about traditional knowledge as we go along. There really has been very little impact of big data sets and traditional complementary and integrative health. So John, I think, has been working a lot more in this area than other people, using big national data sets, but many governments don't even collect that information on utilisation, prevalence, and to be frank, don't even know what's happening in their own communities. Environmental issues. So, we mentioned appropriate harvesting, growing and production, and meeting unmet needs for addressing gaps in better care. So, chronic disease and prevention, fixing issues that have emerged from current approaches to health. So antimicrobial resistance and opioid epidemics was a big thing, and financing. And so, there was a sort of, I guess, mix of people who thought that, this could actually reduce health costs, and others that thought they could actually balloon them quite substantially. And looking at issues of accessibility and appropriateness, Ricardo mentioned access, getting it out from people that can actually afford it, getting it into conditions where it might actually be helpful. Is it an untapped resource, or is it an unnecessary burden? So, having a public health critical, rigorous gaze that actually can help unpack where it might be appropriate and where perhaps it is not. Collaboration, education, integration. So again, people need to live longer, but they need to live well. So, incorporating, I guess, more holistic, traditional complementary approaches are known for having that holistic nature in that, and looking at, I guess, health, mindfulness and wellness, and whether that might be an appropriate model to look. Barriers that exist, structural, political and ideological. Health literacy. So obviously this self-empowerment, self-care was something that came up as well, but as well as, development of resource to help people choose appropriate forms and avoid appropriate forms where that might need to happen. So the ethical issues, how do we look after a population that turns to alternatives and potentially rejects conventional treatments before as well. Identifying problems, identifying strengths, and going beyond practitioners and products. What are the cultural drivers and what can they teach us? And I think this is something we forget about traditional and complementary medicine in many respects. It's often a purely patient-driven phenomenon in many countries. So examining what drives people to traditional and complementary medicine, but also importantly what drives people away from other available resources, can actually teach us a lot about how to deliver accessible and effective care. And a big one, so there was an Indigenous working group, Indigenous World Leadership Dialogue a few days ago, which was really great. But traditional medicine and knowledge. So how do we actually engage with traditional knowledge in a meaningful, critically rigorous way that both respects science and tradition? Some people gave examples of Indigenous practices being less respected in their own countries than imported, if you will, traditional practices. So chiropractic is allowed to do spinal manipulation in New Zealand was an example, whereas Maori, Rongo Maori, the traditional Maori practitioners are actually banned and outlawed from doing their traditional practices in physical medicine. Research on Indigenous medicines has little incorporation of Indigenous knowledge, and for this reason it can lead to co-option as much as integration. An example of that is policies that may look at traditional medicines or Indigenous herbal medicines. The regulators may require purely just a few ethnographic studies and no meaningful engagement or relationship with the traditional owners of that knowledge. So, actually making sure that that's actually built into those value chains, and not those value chains, so those regulatory frameworks. And appropriate sovereignty and ownership where that actually belongs. So IP is a big issue that is I think WHO and WIPO are actually doing quite well on, but it is still an increasing problem that we do see in a lot of traditional medicine systems. So they were the three main areas. And basically what we're hoping to get from you guys and segue into, I guess, a question and answer session, John, is what are the next steps? What have we missed, and what areas are important to you?
Thank you, John. Yeah, and just to continue that, I think we should open up an invitation to the floor for attendees. I see that we have 41 or 40 attendees, apart from the four of us here. So that's pretty fantastic. I wonder if anyone would like to either jump in with their microphone or provide some chat if they would like to write out a question. If not, you will find that we can keep going for a tad longer, I'm sure, but it would be interesting if someone has a question that they'd like to ask anyone on the panel or the panel collectively. You need to use chat. I've been directed. How to guarantee, thank you, Ingrid, how to guarantee integrative practices when there is an anti-science movement worldwide. Anyone like to jump in on that one? Okay.
I'll have a go, John, if you
feel free.
Yeah, that's okay. So I think this is why public health is actually quite I guess an important way to look at this, because we need to look beyond dogma, we need to look beyond stigma, and we need to be truly critical about this. And I think we need to acknowledge there are probably some practices that fall, in complementary medicine by definition is a dumping ground definition. It's defined by what it's not rather than what it is, and there are useful parts and less useful parts. But I think having that sort of critical and rigorous approach that can actually get past some of that anti-scientific, I guess, assumption of many of these practices, and actually look at what really does work and what really doesn't work. And there are a really good example I always try and use is you've used anti-science, but the Australian National Research, NRIS in Australia, which is the main vaccination research network, actually has a very positive relationship with the homeopaths who actually help them dispel some of the anti-vaccination materials that get put out by the homeopathic community. So I think there are a whole host of really potentially beneficial relationships that people probably haven't been able to get past the fact that we're supposed to be different. But if we actually got past that dogma and stigma, there'd be a lot of potential collaboration for good.
And I think, John, the thing to probably stress from the four of us and the agenda we're promoting here, which links to the question but is probably not directly an address to it, is to be very clear that this is a non-partisan, critical, scientific, rigorous approach that we are espousing. This is not, I think part of the history of the academia and scholarship that's gone on around this topic is it has been fairly extreme in both camps. So we've had people who, with very little scientific evidence, have been basically touting traditional complementary and integrative medicine as things that beyond science that we just need to use because they're fabulous. They have a miracle property. And then at the other hand, on the other extreme, we have hypercritical, conventional and very conservative commentators who I think equally just simply deny the importance of all of us in public health as a global community understanding these practices. And just to make one particular point, which I think fits in nicely here, is that even if we were to suggest that there is very little clinical science or evidence to back traditional complementary integrative medicine, that does not discredit the study, the scholarship, the public health academic study of this topic, because it is still a very fundamental part, as John mentioned himself. It's, it makes up basically a covert but significant part of people's healthcare seeking, their healthcare practices. And it would be remiss of us in public health to look at a vast majority of substantive topics that we're all interested in and pay no attention to this very large component of people's behaviors, motivations, and understandings of how the world works. So just in that very disciplinary and academic scholarly context, I think this topic, unfortunately, to the detriment of most of all public health, has been pretty much denied or neglected substantially. Oh, we have another question here. Aisha says, in Indonesia, government has tried to increase research and practice in traditional and integrated medicine, but I identified several problems related to its utilization amongst our people, in which they make some herbal medicines themselves instead of going to professionals. I found out that multidisciplinary health workers have not engaged well to build a good system for this in Indonesia. I imagine John will have something to say about this, but I'd also like to just start in redress to that, which is that this raises a very interesting and very important point. If we don't study and understand these practices and behaviors as they are currently mapping across the landscape globally, then we have all sorts of problems for the healthcare system more generally, but also for mainstream health providers in terms of understanding what people are using, under what conditions, in what ways. And there are John and I have written quite extensively about risks, both indirect and direct, that come from basically just not understanding or knowing enough about what people are currently doing on the ground. John, would you like to add anything to that?
Yeah, and I think sometimes there's a desire by governments, if they just look the other way, it will go away. And I think examples such as you've mentioned before, home utilization might be actually quite appropriate if there were appropriate resources to help show how people have to do it properly, for example. So not everything has to be practitioner directed, but it does need a public health attention to show how to do whatever practices are being done in a safe and effective way. And when you're looking at, we talk about evidence quite a lot, and I think the one thing that we miss a lot in the traditional complementary TCIH space is implementation. So, once we actually have the evidence, the implementation is still not there. There's still this assumption that if a medicine works and an alternative medicine works, it's just called medicine. We know socially, culturally, politically that there are all sorts of reasons why that doesn't flow through. Just as there are many medicines that conventional medicines that actually don't work, that are still very embedded within systems. So that implementation space is a really strong role for public health to apply what we know works and what doesn't work, and actually build better health systems that way.
Thank you, John. And just following on from that, I see we've had another comment from Ronald, which is about what about the sciences and evidence-based research around various plant medicines and psychedelics? Is there progress you see worldwide? I think others may want to add to this, but of course, as John mentioned in his talk, and I think we are all very keen to promote this, is that clinical research is part of the mix. It is important that we keep an eye on efficacy and what the developments are in science and evidence base, and not to dismiss that at all. That is fundamental. But one of the things that has been to the detriment of our discipline, I think, and our scholarly public health approach to this is that we equally historically have been pretty hung up on clinical efficacy to the detriment of thinking about all other issues to do with this topic. And I think the problem we face there is that we do end up being a mouthpiece for the medical profession as opposed to critical public health scholars and researchers who have other perspectives equally that are rigorous and are legitimate. So this is not in any way, I don't want anyone to think that what I'm mentioning is in any way bashing clinical science or evidence or suggesting it isn't important. That is not the case. But I'm just trying to make the point that, where historically 99.9% of the focus has been on clinical efficacy, public health has so much more to offer this topic. And if I could just extend that even further with some examples, if we think about equity and vulnerable communities, if we think about, as already has been presented in a number of talks today, looking at indigenous traditional knowledges versus colonial knowledge, so decolonializing the thought of healthcare. These are all fundamental to the progress, I think, in the future of public health more generally, but they're things that this topic not only will provide further evidence for or be interesting to look at, but I think will give us insights for other areas in public health as well that we desperately need in an anti-scientific world that's dominated by misinformation and a million other problems. I don't know if anyone else on the panel here would like to continue with that riff.
I would like to add that one perspective that is very important to stress is the model of care, because as example of depression that mentioned, and nowadays there is a big epidemic of medicalization and with assistance that in short time and how to look to the patient in the public health system. Then I believe that broader approach, looking the person in a multidimensional way, it's very important nowadays, and include together multimodal approach like exercise, Tai Chi, and the medicinal plants, and it's a question of paradigm, I believe, to look to infirmities, disease in a new way.
Now, I would like to emphasize what John was mentioning in terms of that we need to look at all these array and variety of healing systems and traditions from a decolonialized perspective. We have been very focused on does it work, or whether it does or whether it doesn't work, and whether it does for specific conditions. But those questions have been asked from a very biomedical perspective as well, and from a very colonial perspective. And we need to ask other kinds of questions also in terms of like, where is the order of things, like what those practices mean in a specific context, how they have been developed through centuries and millennia, and within which context of being within those societies, those practices are being used as well. There's a whole host of questions that need to be asked, and that are relevant from a public health perspective, and that need to be asked from different frameworks that we have been doing it so far.
And I think bringing it back to Ronald's question, like I think a big problem with the way that I guess historically we've looked at this issue is a very black and white kind of issue, and there's always many shades of grey and many layers of complexity, and public health sort of revels in complexity. And when you're looking at things like psychedelics and medicinal uses, biomedically or politically, they've often just been seen as, I guess, psychedelics or drugs. And we've seen it with medicinal cannabis, how it's confused a lot of governments how to actually deal with something that might be medicinal in purpose and is also a recreational drug. So, public health sometimes has to actually be able to actually keep those two things in mind. And so having that ability to deal with complexity and potentially two solutions to the same issue is really important. So I think that's certainly why I think public health is the best tool to do that. So
good. I think just one other thing I'd like to make a general comment, which is quite a big, broad part of this agenda, is that I do know until very recently that and I'm sure others on this panel will have the same experience, that as Daniel was saying, that the World Congress here, this is the only session which is truly dedicated to this topic, which I think partly what's happened with public health, at least in my experience working in it for 30 years as an academic, is that it has changed from being a very medico-central discipline, which was seen as a place where people from the medical profession would often go to find an alternative, more holistic, preventative approach to doing care, to now being something which is truly multidisciplinary. And the point of that really, and it's a very broad ideal type brushstroke statement, I understand, and there's many variations on that, but there's something in there that I think is very important, which is that public health not only, I think, has a responsibility to look at this topic and to take it seriously and to be the guardians, if you like, or, you know, thinking about being the leaders of unpicking this kind of information. But I think there is a prize for public health as well, the global public health community, and obviously for humanity, which is the fact that this will allow us to think very differently in lots of different ways about very conventional topics that we have been thinking about, sometimes with great success, but can be fine-tuned, but in other ways with great frustration. So I'm not suggesting for a minute that this topic is going to provide an answer to all public health issues, but what it will do is provide a critical perspective through looking at a topic. And John mentioned earlier implementation. If we look at even the new sub-branch of science, which is implementation science over the last 15, 20 years, I think there's a lot of work we need to do around this particular area of healthcare and practices and behaviors that can shed new light on how we even think about implementation as a scholarly activity. How do we translate and be impactful in what we do? And I think if we use this particular area of healthcare as a case study, that has great advantages. I can quickly see that while I'm talking, we've got another question in, or just a statement. I'll read it out. In Finland, I would say the situation is very black and white. Even the idea of some kind of integration would be attacked by the medical community very strongly, even though the medical community fails to help many patients that don't experience getting help in the medical healthcare. It feels we can't see the potential of integration. And I think many of us who have worked in this area for some time have felt some of this politics that is there. And we have to finish in 2 minutes. So I'll just make this very quick and then I'll let others say a few words. Just for those of you attending who have hopefully found this interesting and you may want to do more, I don't want to just look like we're self-publicizing, but we do have a book collection, the first book collection that's published just last year, 2019, called The Public Health and Health Services Research of Traditional Complementary and Integrative Healthcare. It's an edited collection, and the chapters cover many, many of the disciplines and many of the methodologies and issues that we're talking about today on this session. Others, we have 1 minute left if you'd like to say a few words to everyone.
I'd like to add about that question from the experience of Finland. My own experience as a pediatrician and in the public health hospital is that there is a big need of increase the quality of life of the health professionals that have a high level of burnout. It's a good way to go against the resistance. There's some strategies that were experienced in several countries, how to go into the integration. I believe that it's important to share that experiences, but we are doing a lot worldwide. I think it's the moment of collaboration between the countries. It's very important to share.
And I would like to add also that even though in countries where there's resistance to officially develop policies for integration or develop infrastructure and do it in an organized way, people are integrating these practices in their own care. So there's different levels. There's different levels of integration, and even when it's not visible at the structural level, it's happening at the population level, and those are the kinds of questions we should. It's part of those kinds of questions we should be asking from the public health perspective in terms of shedding light into the different approaches.
Thank you, Daniel. I think we should probably finish there. John, do you have a quick comment to make before we go?
I was just going to say, Sade's point is perfect because, public health is social, cultural, and more importantly, political. And so is this topic. So they're two areas that are very aligned and really need to be taken together a lot more.
Right.
Wonderful.
And I would like also to take this opportunity to mention that we are in the process of developing a working group within the World Federation of Public Health Associations, brought together by this collective of working groups within national associations and others. And if you're interested in
Join us.
participating of the process, please join us. Yes, we'll be very glad to have you working with us. So please,
Okay.
you can leave
Well,
your
we're-
messages, your contact
We
information
have
on
to
the
go.
chat.
Yeah. We have to go now. Thank you everyone for listening and taking part. We appreciate it. Thanks to all the presenters, and we hope you enjoy the rest of the Congress and you don't forget about traditional complementary integrative healthcare in a rush.